Hi, Kevin Henry, the Group Editorial Director for Advanstar and Dental Products Report, and I'm on a Google Hangout today with Tim Caruso. And Tim, would you take just a minute and introduce yourself and give our viewers a little bit about your background?
Sure, Kevin. I'm a physical therapist. I've been practicing for over 20 years, we'll say. That's a good answer. And I've been working with the dental profession since the late 80s on a number of problems and maladies that they have.
And Tim, I know one of the reasons that you and I are talking today is an ebook and a webinar that you are working on with us, and obviously it deals with ways to avoid work-related pain. So what's the biggest mistake that you see dental professionals make whenever it comes to ergonomics?
You know, I think a lot of professionals think that ergonomics means having to outfit an entire operatory perhaps with all new equipment. That's not necessarily the case. And a lot of folks tend to ignore their aches and pains during the course of the working day to the point where it becomes a chronic problem rather than a daily, once in a while problem.
You know, in the ebook, you talk about 7 ways to avoid work-related pain. So can you kind of give us a sneak peek and maybe talk about 1 or 2 of those?
One of the things that we talk about is good working posture and being mindful of that. So one of the things that we do recommend as a tip is to actually have some coworkers take some action photos of people in the operatory doing what they do on a daily basis and not cueing them when they're doing it, so you actually catch them quote unquote in the trenches doing what they do. And I think the other is thinking about some perhaps some chairside stretches and activities that they could do as a coping strategy during the working day.
So I know you've worked with a lot of dental professionals. Can you kind of maybe have a success story about one of these dental professionals who has learned the proper way to sit and to work, and it's really extended their career?
I can think of one in particular that was sitting on an old operator stool that was broken and not working very well, and it causing them to sit in really an imbalanced position during the course of the working day. And they kind of got used to working in that position to the point where they were having some raging back pain. And in changing their operator stool and their working posture, we were able to get them back to work and through an entire working day without any discomfort.
You know, I know ergonomics is a subject that's talked about a lot, and there have been a lot of articles written. What, you know, if you were going to cut to the chase, what's one thing that you really want dental professionals to know about ergonomics?
I think that ergonomics can be something really simple as sitting up straight, sitting in a balanced position, and paying attention to your body and some of the aches and pains that you may have, or some of the perhaps discomforts that show up during the course of the working day, and looking into balancing out how you sit to do your work.
Well, Tim, I appreciate your time, and obviously encourage our readers and our viewers to download the ebook, and also to watch the webinar series that Tim will be putting on. And Tim, really appreciate your time, man. Thanks so much.
Hey, Kevin, thanks so much. It was good to talk to you tonight.